Hey, do you have dental ailments? Have you been waiting for the right time to get yourself treated? And the right time hasn't come yet? Are you really scared of your problem getting flared up at this time? Well, I'm here to guide you for that. I'm Aruti, a prosthodontist by profession, and I will be instructing you about dental hygiene measures and special care that you can take during this lockdown time and always. So let's get started. First and foremost, brushing, which is very important for your dental well being. There are a variety of brushes available in the market, manual as well as electric. You can opt for any. If you have manual brush, you need to know the right way of brushing. Hold your brush at 45-degree angulation in between your gums and teeth. Brush the outer surface of the back and front teeth by moving the brush in vibratory motion or jiggling motion and swipe it out. Brush the inner surface of the back teeth in the same way. Brush the inner surface of the front, upper and lower teeth by tilting the brush vertically using small up and down strokes. If it is difficult to perform vibratory strokes, you can always switch on to circular strokes instead. Brush twice daily. Use a fluoride containing toothpaste. Change your brush every 3 to 4 months and use soft bristle brush. And yes, brush not more than 2 minutes. Don't skip your tongue. Gently brush your tongue to remove odor-causing bacteria that will help give you fresher breath. Flossing, second but most important thing. It's a method to remove microorganisms and food particles from areas between the teeth that are difficult to reach by brushing alone. You need to have a good quality floss and also you need to know the right technique to use it. There's several videos available on YouTube for the same. For added protection, you can always use mouth rinse. Mouthwash can get to places where toothbrush or even floss cannot reach. Opt for a fluoride containing mouth rinse. It strengthens enamel and prevents cavity formation. You can reduce the risk of tooth decay by eating right. Eat nutritious balanced diet not only for overall health but also for your oral health. Be sure to include plenty of dairy products, crunchy fruits and veggies and whole grains in your diet. Some food that are especially good for oral hygiene are cheese, yogurt, milk, and peanuts. This food can help reduce and remove sugar from the tooth surface and protect the teeth from plaque. If you want to have sugary food and drinks, have them with your meals. Saliva increases during meals, which will help weaken the acid and rinse the food particles from mouth. Limit sugary products, drinks, and snacks between meals. Many sports drinks, juices, and energy drink have added sugar, so avoid it. Drink plenty of water. If you have crown and bridges, avoid chewing anything hard or sticky on the temporary crown. Example: avoid gums, taffy, hard candy, hard crust breads, etc. Avoid chewing anything sticky on permanent crown or bridge. Example: gums, taffy, gajak, etc. Brush as usual but floss with care. When flossing, remove floss from the side of the tooth. It is important to brush and keep gums tissue as clean as possible. Additional use of fluoride rinse and a high fluoride containing toothpaste are excellent for preventing additional root caries. These additional aids are important for people with high caries index and people with history of periodontal disease. It is extremely important to maintain excellent oral hygiene with your crown and bridge. Some people have this misconception that crown tooth no longer needs to be maintained, which is very wrong. Crown and bridges are still susceptible to decay near the gum line. Fixed bridges needs additional cleaning under the pontic. For proper oral hygiene methods for dental patients, take out denture after every meal. Wash it with water to remove debris and food particles. Handle your dentures carefully. Be sure you don't bend or damage the plastic or clasp while cleaning. Brush your teeth and clean your mouth after removing denture. Brush your natural teeth with soft bristle brush. Use the same brush to clean your tongue, cheek, and roof of the mouth. Remove any remaining denture adhesive from the gums if you have used. Brush your dentures daily. Soak denture in water overnight to keep it moist and not lose shape. Brush your denture and rinse it thoroughly in the morning before using. Call your dentist if you have loose dentures, irritation, sores, and infection. Things you should avoid if you wear dentures. Avoid hard brushes, abrasive toothpaste as these damages the dentures. Whitening toothpaste are not required because it can't change the color of your denture teeth. Bleaching products can weaken dentures and change their color. Don't soak dentures with metal attachment in solution that contains chlorine because it can tarnish and corrode the metal. Hot water can warp your dentures. For dental implant patients, seal around dental implants are not as same as natural teeth. A special kind of floss is needed which is more fluffy to pick the microorganisms that accumulates on the abutment and underside of implant crown. For example, superfloss. Floss at least once a day. For implant bridges prosthesis or full arch prosthesis, use combination of toothbrush, interdental brush, superfloss and an oral irrigator. Apart from these instructions, there are many home remedies that can help you prevent dental emergencies, like frequently doing warm saline gargle, turmeric gargles, and using or applying mustard oil and salt concoction on your gums and massaging your gums with it. Then using of clove oil in the dental cavity for pain, aloe vera gel, and so on. But you have to make sure that prevention is always better than cure. Thank you.